Health experts are urging Americans to get their flu shots as winter approaches, or is already here in some parts of the country. The CDC reports at least 650,000 illnesses, 7,000 hospitalizations, and 300 deaths from the flu so far this season. Now, there's a new flu strain, and it's causing particular concern for older Americans, and vaccination rates are at historic lows. So experts warn this could be an especially brutal flu season. Dr. Toluwalasé Ajayi is a pediatrician, a palliative care physician as well, and a researcher and a member of the American Medical Association, and joins us now from New York. Thank you so much, doctor, for being here. Look, I mean, we are all urged to get the flu shot in the fall. So a lot of people might think, well, you know, there's snow on the ground some places, it's cold, it's just about winter. Is it too late? And really, why should we be getting the shot in the first place?
Oh, Holly, thank you so much for having me here, and thank you for those great questions. I will start by saying it is not too late to get the flu shot. In fact, I would say now is a perfect time to get the flu shot, especially as we're getting together for holidays, we're inside more. This is the best time to give the gift of immunity by getting the flu shot and protecting you and those around you that you're going to be around.
It's not too late? I mean, you can get it any time within the season, because I know typically the push is to get it around September, October, the fall, as the flu season approaches.
You know, we do want people to get it, you know, before the end of October, but that's never too late. The flu typically peaks around January to February, depending on where you are in the country, and it takes about 2 weeks for your body to build up that immunity. So getting the flu shot now, getting the flu shot later is always a good idea. In fact, anytime the flu is circulating in your community, it is not too late to get the flu shot. So we absolutely recommend it. It's never too late.
And who should be getting the flu shot, and why is it important for certain groups to get it?
Yeah, we recommend that anyone who's 6 months or older get the flu shot. We know that the flu is particularly bad, and I think you said this in your intro, for those who are over the age of 75 and are really young babies who are not even old enough to get the flu shot, and really depend on us, those around them, to get protected.
So, you know, many people think, okay, it's just the flu. I'll be down and out for about 24 hours, not a big deal. It's not like COVID, where I had to quarantine and so many people died, but there are real concerns. So if you would explain to people why it's so important to have the flu shot.
You know, Holly, people do underestimate how serious the flu is. Last year was one of our worst flu season in quite some time. It was the deadliest for kids especially. Over 200 children died last year in the flu, and that's the worst in the 15 years since we've been tracking the flu vaccine or the flu data. So we know that getting the flu vaccine prevents really severe illnesses and can turn, you know, what could be a couple of days of feeling, it could turn what could be a couple of weeks in the hospital to just a couple of days of feeling miserable at home. So please do get the flu shot, and don't underestimate how serious the flu is.
Let's talk about, I guess you could call it the elephant in the room. There's quite a bit of anti-vaccine sentiment going on now. And with our HHS secretary among those who are skeptical, recently Baylor College of Medicine, a vaccine researcher there, drilled it down and said he found a steep decline in vaccinations overall. 77% of U.S. counties have seen a steep decline in vaccination rates since 2019, which includes the flu vaccine. So are you concerned we could be facing another flu epidemic? And if so, how bad could it potentially get?
You know, we are very worried about the flu this season. Like I said, last year was categorized as a very severe flu season, and we saw, again, the highest number of kids who died from it. Of the kids who died last year, 50% of them were perfectly healthy. You know, they had no pre-existing conditions, and they died from the flu. And we also know that 90% of the kids who died last year from the flu were not vaccinated. This year, we're seeing, like you said, Holly, lower vaccine rates, and we know that vaccines can prevent serious illnesses and death from the flu. And so we are worried about the low vaccination rates and how bad the flu season can be this year.
And Dr. Ajayi, I want to talk a little bit about how the flu virus and the vaccine work, because we know researchers, they study the virus as it makes its way around the world. We know that that virus mutates to basically stay alive. So how accurate are the vaccines this year? Because we know sometimes, I mean, it's a guessing game by the best of the best, and usually they get it right, but sometimes there's a little bit, it can be off. So do we know the rate of protection, and do we know how accurate they are?
We know that the flu vaccine that we have this year protects against 3 different strains of the flu, and that's a really good indicator of how well it can do to protect those around the country. We know that the flu vaccine is really our best option to prevent those serious illnesses. You know, we'll get the data, in the next flu season, but if last year was an indication, we know that the flu vaccine can really prevent serious hospitalizations and death. And so we encourage people absolutely get the flu vaccine this year.
Some people say, oh, well, when I got the shot, I got sick. So it was, I shouldn't get it. There's no reason to get it. But that's not really the case, is it? Talk about why people maybe don't feel so great after getting the flu shot. And do you get sick from the flu shot?
Holly, I feel like you've been talking to some of the parents of the kids I take care of. That's something I hear a lot. And I will make it very clear. You cannot get the flu from the flu vaccine, right? The flu vaccine is made up of inactive flu material, so it's not going to give you the flu. It's not uncommon for some people to have a little bit of sore arm, maybe a low-grade fever, but you're not going to get the flu from the flu vaccine. It protects you from getting seriously ill from the flu.
All right, so tell us, if you would, about the Get My Flu Shot campaign and the No Time for Flu PSAs.
I am so glad that the American Medical Association is partnering with the Ad Council to get this information out there. We have a really, really helpful website called getmyflushot.org. That's getmyflushot.org to really provide patients and actually other people in the community about information about what's going on with the flu, the best place to get vaccines, and really information for people who have questions or concerns. Going to that website is a really good place to get information in addition to talking to your doctor.
Some great advice. We know how important it is, and vaccinations save lives. Dr. Toluwalasé Ajayi, thank you so much for your time, your insight on this. It's so important for everybody to hear this. We appreciate your time this morning.